When I first started noticing it, it was probably about 4 years ago. You know, every once in a while I'd get bothered. Like, it might have happened like a couple times during the month that I'd get some pain, and then I wouldn't feel it for a while, and then it would come back. If I tried doing the activities I did, I was just in too much pain.
Coordinated health really has the best of what orthopedic medicine can offer, okay? We do things and we take pride in them, and when we treat a patient, we treat the patient as a whole.
When Dr. Favela looked at the MRI, he thought it was that a vascular necrosis. And he pretty much came out and told me, well, we can do a total hip replacement, and that's what I was going to need. I don't think I was surprised when he told me I needed total hip replacement. I just know all the pain I've been putting up with, and I was putting up with it too long.
Hip replacement has been around for years, but there's been an emerging technique to use an anterior approach for the hip replacement, in which we do the hip replacement through an incision towards the front of the hip. This has the benefit of going between the muscular layers and straight down to the hip joint, and very little muscular dissection. It also has the added benefit of letting us do the surgery under X-ray, which provides a much more precise placement of the hip replacement than it does the traditional way.
To go to Allentown to have the surgery done was definitely worth it. Yeah, it was definitely worth it. When I went in to get it done, I went in on a Tuesday and I came home on a Friday. They set everything up for me. I was able to go into my own town that I lived in. There was a place that has physical therapy.
She recovered well after the surgery and is walking much better and having significantly less pain than she did before the surgery. It's really impressive, and in fact there's no hip precautions, which is a common thing with posterior traditional hip replacement. You can't cross your legs after surgery, you can't sit on low chairs. With an anterior hip replacement, you don't have to worry about any of those things.
I went to physical therapy like 2 times a week. Some of the things I had to do were hard, but actually when I would leave physical therapy, I actually felt better.
We do everything we can for all our patients, and we do everything we can to get them back to the lives that they want to live. We hold ourselves to a higher standard, and I believe our facilities and our physicians show that.
It's going on almost a year since I had the replacement done, and it's great. Dr. Favela is a really nice doctor. Any questions I had, he answered, and I do recommend Dr. Favela.